started. You guys should be on the Zoom call for Why Therapy, how ABA and Psychotherapy supports your neurodiverse child's skills for a lifetime. Thank you all for taking time out of your evening to have this conversation with us and join us in this discussion. In this webinar, what we're focused on tonight is understanding the myths and concerns with ABA, gaining clear insight into how ABA and psychotherapy can support your child, you and your family through skills and development, get tools needed to know what to look for and what questions to ask, and how best to determine professionals and organizations to see if they're the right fit. That is so important, and it's so difficult, and it's so hard, regardless, what the profession is. Even schools, interviewing pediatricians, everything, knowing what questions to ask, how to engage in that conversation, how to really understand what you're looking for is so crucial and part of that conversation. So good evening. Again, I'm Tiffany Feingold. I'm the co-founder of Guiding Bright Minds. I am so excited to have you guys here today. I know firsthand as a parent of a neurodiverse child, how overwhelming, how exhausting, how rewarding that journey can be. It takes the good, it takes the bad, it takes all of that and combines it into one. And one of the reasons why my husband and I started this community is because we do understand that journey. And through our experience of searching, what providers, how do we create our support system, our tribe of people that understands what we're going through. And through that experience, I wanted to give back to the community. I wanted to create a platform and a place where, regardless of the neurodiversity, you can all come together to get educated, come to our website to find events. We're continually to expand. We've only been doing this for 14 months. So we're pretty new, but we have a lot more that we want to do. And one of the things about Guiding Bright Minds is that we're building that community. So you can join our newsletter, you can join as a parent, or a caregiver or a grandparent or a guardian as a member for free. And we're going to start enhancing those levels of services. So we just continue to add more to that. And then the biggest thing that I really wanted to do is to create that directory, that network of professionals. We personally interview every single one of them. We talk to them about what it is that you love about what you're doing. Why are you doing? Because again, to know that they are in this because they want to help. They want to be a part of helping your child and helping you and helping your family. So I'm excited to bring that. So continue to look, check us out. I'll add a link to the chats so you can go to our website, you can sign up and just become a part of that. More to come on that. So I'm excited. So let me go ahead and introduce to you our, why isn't it's not sharing the screen. Sorry, I have my bios over on this screen, and which makes me not be able to look at my screen. So I apologize that my head's going to be turned. I don't know why it's never not done that. So first I'm going to introduce Haley Stuart, who is a board certified behavior analyst and at Behavioral Innovation. She obtained her undergraduate degree at Florida State University in May in 2017 with a bachelor's degree in psychology, minoring in child development. After graduation, Haley moved to Lubbock, Texas, to work for Behavioral Innovations as a registered behavioral technician. She found her passion to work for the field of applied behavior analysis and continued her educational journey to obtain her master's degree. She received her degree from Arizona State University in applied curriculum and instruction in May of 2020. And prior to coming back to Behavioral Innovations before the company's expansion into Colorado, Haley worked as the senior clinical support technician in another ABA provider. So thank you, Haley, for joining us. She's going to kick it off, but before I do that, I'm going to quick introduce Cindy. And again, I apologize that my head is turning as I'm reading their bios. Cindy is a licensed professional clinical counselor a board certified behavior analyst, and a certified therapeutic recreation specialist. Cindy graduated with a bachelor's degree in therapeutic recreation and a minor in counseling, a master's in counseling from Old Dominion University, and a graduate certificate from the University of New Mexico in applied behavior analyst. Cindy is the clinical director of Spectrum Social and Recreation Services in Lakewood, Colorado. At Spectrum, Cindy is part of a unique group of clinicians that provide services supporting the neurodiverse population that includes counseling and psychotherapy, behavior therapy, recreation therapy, parent consultation, and social and executive functioning skills coaching. Cindy's passion and expertise in supporting neurodiverse individuals in reducing challenging behavior, managing systems of anxiety and depression, and building skills toward improving, maintaining their health, safety, and quality of life. Cindy has experience in working with individuals experiencing neurodiversity, such as those diagnosed on the autism spectrum, ADHD, and nonverbal learning disorders, as well as supporting caregivers by providing therapy, coaching, and consultation. So thank you both for being here. I know this conversation is important, so I appreciate it. Haley, I will turn it over to you if you want to share your presentation.
Absolutely. Okay. So as Tiffany said, my name is Haley Stuart, and I'm a board certified behavior analyst at Behavioral Innovations. I just want to start out by saying thank you so much for taking the time out of your guys' busy evenings to join us. Cindy and I are really hoping that everybody can gain an understanding of how we can really support our neurodiverse loved ones by the end of this. So really quick, the structure of this presentation, I'm going to go ahead and go over all of the ABA components and really how ABA sets up a great foundation for then psychotherapy and some other different supports that Cindy will then talk about. So on the ABA side of things, we're going to start off by talking about the myths of ABA. So ABA can be an extremely controversial field, and we're just going to go ahead and talk about 6 different myths and kind of the facts behind those and hopefully overcome those. From there, we're going to talk about the benefits of ABA. There are so many different benefits, and really once we can get past kind of that controversial aspect of ABA and really see what those benefits are, it can be an amazing field. And then from there, we're going to talk about how to find a good ABA provider. I'm not going to sugarcoat it. There's a lot of really great providers out there, and there's some not so great providers. So how do we really tease out the best providers for our neurodiverse loved ones? Okay, so the myths and facts of ABA. So I went ahead and I selected 6 different myths that I've heard as a provider. I get a lot of parents that come in and they want to talk about these subjects because, I mean, why would we want to enroll a child in here if we're hearing these things, and they are very concerning. So with that, I chose these 6 different myths. So the first one is ABA is only for individuals on the autism spectrum disorder. So really where this one comes from is early on in the field, there was a lot of research with this population. So with the autism spectrum disorder community, a lot of those early on research studies were done with that population. They were shown, ABA was shown to be an effective treatment. So there was a lot of buzz around that. In addition, a lot of the insurance companies these days, they do want to see a autism spectrum diagnosis, and that varies state by state. But with that, we start hearing that this is only an effective treatment for a certain population. That's absolutely not true. I am blessed in Colorado to be able to serve under Medicaid a variety of different diagnoses, including Williams syndrome, ADHD, really anything that a doctor refers ABA for, I can provide services for. And it does make a difference. I've seen it firsthand. So this is absolutely not true, but it is something that I hear very often when parents first come in. The next one is something that was true at one point in time. Again, I'm going to be very frank about it because in order to move forward in this field, we really do need to talk about the past. So ABA utilizes punishment procedures to decrease socially inappropriate behaviors. Again, at one point this was true. We did use some punishment-based procedures back in the day when there wasn't necessarily an ethics code in place or a best practice procedures. And so with this, there was a lot of trying to figure out, okay, we know this is an effective field, but how do we utilize that with humans as well? Because, you know, we did start out with some animal training, and ABA is a branch off of that. It is not animal training. At one point, there was behaviorism, and this is an offshoot. So this is very a humanized, and we do it all with dignity. But in that, we were really trying to tease out how we were going to form this ABA and really make it into a practice that we could market for a bunch of different individuals. So back in 1998, we do have now a governing body that was put into place to make sure that there was a clinical best practice and that there was somebody kind of overseeing these practices, because at one point, again, punishment procedures were utilized, and no, I don't think any BCBA at this point really agrees with how it was done in the past. But again, it was done. So then in 2010, we do have an ethics code that was put into place. And now as a BCBA, we're told that we have to use and exhaust all reinforcement-based procedures prior to ever moving to a punishment procedure. And if we are to utilize a punishment procedure, all parties must be informed, consent must be given. So I personally have never utilized a punishment procedure because usually you can use these reinforcement-based procedures in order to help that individual be successful. So again, I think it's important that we do talk about punishment was used in the past, and sure, there might be some providers out there that still use it, but then later on in this conversation, we're really going to talk about how to find a great ABA provider. And if you don't want your loved one to go through a punishment procedure, then we can ask those questions and we can kind of talk about, as a BCBA, what are your beliefs? The next one is learning environment sterile. So again, all of this is experiment-based. So in experiments, we know we have to reduce a lot of variables, right? So we can't have a lot of extra stimuli around. We're sitting at a desk with very limited variables. So that's kind of how this one started up, as well as, you know, moving in the field, we now really want to see naturalistic opportunities for learning. So it was at one point very experimentalized, and now it's very individualized. And so we want there to be tons of opportunities for learning. I mean, I'm blessed at Behavioral Innovations to have tons of different toys that can promote language, can promote social skills. So by no means is the environment sterile. I love giving tours to parents because they always ask me, they're like, so you want my child to sit here for 40 hours a week with you and play with the same toys? Well, come into the back. Like, let me show you how many different learning opportunities we have, all the different unique materials that we do have and that your child has access to play with throughout the day. So again, by no means are the learning environments sterile in ABA. Then ABA turns individuals into robots. So this is also untrue. ABA is very individualized. That's the number one word I would put to ABA, is individualized. So when individuals come in, it's all about how can I help them? How can I change their quality of life? And really with that means different programs, different items we're working on. Maybe we're working on social skills for one child, but we're working on sitting at the table for another because they are going to go to school eventually. And we also make sure to teach the generalization. So I'm not going to sit in one environment and teach you what a car is. I'm going to teach you across all sorts of different environments. I'm going to teach you how to respond to different greetings. So if I say hi, maybe sometimes you say hi there. Other times you say, how are you today? And we're really making sure to generalize so there's not robotic behavior. That's never the goal. I never want to discharge a client who only knows how to respond to a greeting in one way. Another one is ABA is only about decreasing socially inappropriate behaviors. And I absolutely see how this one comes about, because a lot of times what we want to focus on is, you know, kind of how it feels so heavy on us. You know, my child's engaging in biting behaviors. I need it to stop. Please help me, is kind of how these parents are coming in for services. And really my next question is, okay, so what are they good at? Because really what I want to do is I want to increase their skill repertoire. And ultimately, that's going to decrease the socially inappropriate behaviors. I'm not necessarily just going to sit here and just try to diminish the inappropriate behaviors, because really the only way to do that is increase the appropriate behaviors. So it's really, really about how to teach socially appropriate behaviors and increasing those rather than focusing on that negative. Eventually, that'll fade out if we're using the proper techniques. And then individuals learn through bribery. I think this one is really important to know the difference between reinforcement and bribery. So they're two different things. So reinforcement is when a behavior occurs and we add a stimuli to that right after it occurs to increase the likelihood of behavior occurring again. Whereas bribery, we're already maybe in a scenario and now a behavior occurs and I'm sitting there and I'm saying, hey, if you stop, I will give you the Xbox you've been wanting. And then the individual stops. Now they've learned that, okay, I'm gonna engage in that behavior and now mom's gonna bribe me with something and I can, we're not really learning any appropriate behaviors and we're not increasing any behaviors over there. So it's really important to learn the difference between reinforcement and bribery because they're absolutely not the same thing. In ABA as well, we do use a lot of reinforcement-based procedures. So that does look like, hey, great job doing your work with me, doing your worksheet at the table. Let's go do a 5-minute break of playing cards on the floor. Sure, maybe that might look like bribery to some people, but really it's not. It's reinforcement. You did what I asked. We did, at the end of the day, I did my work at Behavioral Innovations. I get a paycheck. Same type of thing. And we kind of just need to tweak our lens on that because they're not the same. So again, there's tons of different myths out there, but these were the 6 myths that I felt like I've heard the most as a provider in the field. So again, at the end of this, hopefully my contact information will be shared. And if there are other myths and concerns that you would like to talk about, I would be more than happy to take time to answer a phone call, answer email questions, all sorts of things, because I do really want to clear it up. So moving forward now, we're going to talk about the benefits of ABA. So there are, again, thousands of different benefits of ABA. And really when I think about ABA, it's individualized. So it is really different. Each kid that walks out the door at the end of services comes out with a different benefit. So one might be coming out with great social skills. Another might be coming out, with great communication skills. It really depends on the individual and kind of what we agreed on tailoring services towards. But some general benefits of ABA are individualized treatment goals. So we're really going to sit down and talk about what's going to be effective in your life, what's going to change your quality of life, and the child's quality of life. Ongoing assessments. So we're never just going to take a quick snapshot from the beginning and just run with that throughout the rest of services. We're constantly running reassessments and reassessing where the child's at. Okay, so I taught this skill, which means now I can jump maybe 2 skills ahead, or maybe we need to go on to the second skill. But ongoing assessments is a huge benefit of ABA because we're never just going to assume that the child knows it. We're always going to be doing the evidence-based assessments. Direct oversight of treatment is something I love because as a BCBA, I'm doing a lot of supervision on the floor, especially in a clinic-based setting such as Behavioral Innovations. I get the pleasure of being here 40 hours a week and I get to see my kids every single day. I get to greet them when they come through the door. I get to see how the therapists are interacting with them. Sometimes I'm passing in the hallway and I can correct quick errors if they're running things incorrectly, or I can tell them they're doing a great job. So it's a really great component of ABA that we do require supervision of the clients because they are getting, such great services that way. And we're really able to break down skills if they're having trouble with those skills and make sure that the client is successful. Increase communication skills. It's evidence-based. We adhere to an ethics code. Insurance will cover some services. And again, this is kind of like an asterisk with it because it depends on what state you're in. It depends on what insurance you have, as well as what the diagnosis is. But it is it's great that it does cover some of the out-of-pocket costs for you most of the times. Support system and advocacy. I'm super, super passionate about this one because when people enter my doors, even if it's not a great fit for services, you're not alone anymore. Maybe this is just the starting of your journey and I'm absolutely going to help you find the best provider. When I do have clients that do enroll in services with me, you now have such a vast pool of resources. So, a lot of times when you are a caregiver of a neurodiverse individual, you feel alone, like you don't know where to go, you have no idea where to start. Once you sign up for services with Behavioral Innovations or, another ABA provider, you really are opening up all sorts of different options for services and supports. So I think that's a huge benefit of ABA. You're no longer alone. We're going to walk you through this. You're part of the team. I'm so invested in your loved one services as well. We can work on adaptive living skills. We do caregiver collaboration, so you're more than welcome to be involved in services. Increase social skills, as well as decrease some of those socially inappropriate behaviors. So now we're going to talk about finding services for an ABA provider specifically. So again, I don't think that there's always going to be great ABA providers out there. I'm sure everybody's on some sort of like social media page where we've heard horror stories about providers. Yes, the field has, changed, but there's never going to be like a perfect sort of scenario where everybody's doing everything the same. There's good doctors, there's bad doctors. I mean, it goes for every single profession, and I really do want everybody to walk away today and have some idea of what to look for in an ABA provider to know that they are going to be the best quality for your loved one. So really, when we're talking about kind of this handout that I created, and hopefully we can share it with you guys in the end, and you can use this if you are looking for ABA services. I'm thinking about, so when we first identify, okay, maybe I need to look into ABA services. What do I need to be sitting down and thinking about? And then when I go on the tour of the providers, what do I need to be asking? And really during this process, kind of making sure we're taking notes and we are interviewing providers and we're making sure it's a great fit for both parties, because ultimately we're not going to have a great ABA experience if we're not finding the best provider for our neurodiverse loved ones. So in the beginning, I think it's really important for us to kind of sit down and create our ideal provider, right? So what are we ideally looking for when we walk into these tours? What's going to change our loved ones' quality of life? What challenges are we facing that we want help with? What's the end goal? Are we looking at school, work, best quality of life? Those are all great answers, but kind of sitting down and teasing some of these things out. And then identifying our ideal level of involvement with services. So in ABA, there's clinic-based, there's in-home based, there's community-based. Really with those, we need to sit down and realize, okay, so if I want in-home services, I need to make sure that I'm available to be home all day with them, to oversee services, because you can't just let them be at home by themselves. That's not best practice either. Or do I want to do clinic? Can I do the transportation day-to-day to the clinic? How involved do I want to be? Do I want to have monthly parent meetings? Do I want to talk to my provider daily? These are all great things to kind of identify prior to starting that touring process. And then identify the qualities you want to see in a provider. So what are you looking for? Are you looking for somebody that's super open and personable? Are you looking for a great communicator? Are you looking for somebody that has a certain number of years of experience? Are you looking for somebody that's really special, has a specialty in like augmentative and alternative communication devices? Like what is going to be the best fit for your neurodiverse loved one? So before we even start the tour process, I think this is a great sort of exercise for us to work through to kind of move forward and know what we're walking into and what we want to see. So then during that tour process, they're probably going to give you the spiel. They're going to ask you about your neurodiverse loved one, kind of what you're looking for in services. So that's where that before piece comes into play. And then during, we want to also follow up with a lot of questions. So I think a lot of times providers, they put on a great show, but we also need to be able to push back and really make sure that this is going to be a great fit. So some of the questions that I identified that I think would be really beneficial, especially in finding an ABA provider, would be asking them how they think their professional skill set will benefit your family. So maybe we're talking about social skills. Oh, well, I have a specialty in this department with the social skills, so I feel like I could really provide your loved one with this quality of care. How do you train your staff? I think this one's a huge one. And at Behavioral Innovations, we're blessed where we do have all of our therapists working for their registered behavior technician credential. A registered behavior technician will provide you the best quality of services because ultimately they are held to a certain training expectation as well as an ethics standard. Some of the ABA providers out there, they won't necessarily require that their staff are registered behavior technicians, which then means that they're not necessarily following any sort of ethical guidelines, or they're not necessarily answering to a governing body, whereas an RBT would be. What type of teaching procedures do you utilize? So this kind of goes back to like sitting at a table. Are you going to make my child sit at a table all day? The best answer to this question, in my personal opinion, is a mixture of different teaching techniques. So we're going to work at the table, we're going to work on the floor, we're going to work in the gym, we're going to work in the community. A really great mixture to make sure we're getting all those generalized skills in place is going to be the best service for your child or your loved one. What are your behavior management philosophies? So do they utilize punishment procedures? We want to be very frank about that question if that's something that really matters. And I would imagine most of us don't want our neurodiverse loved ones being punished. And if we do, we want to be very cautious about how that's being done. Do you utilize restraint training? A lot of companies will utilize restraint training, but they're not necessarily certified in that. At Behavioral Innovations, we're safety care certified. So I have a lot of parents that will ask, okay, so if my child does engage in behaviors, how does this look? How will we handle it to make sure other kids are safe? And it's always, you know, we are certified. I've never had to personally use it, but that is something that is in place. And then what opportunities for parent training? I think, you know, the best outcome is when all parties are involved and everybody's participating. So I think it's really important that the provider is willing to give you training if you're looking for it. Again, you don't have to be looking for it. But if you want to be involved, I think you should absolutely be involved. In my clinic, it's a very much so open door policy. If you want to come into the back and you're 15 minutes early, come on into the back. I'm absolutely going to show you what we're working on. Because in the end, I really want you to, you know, feel great about services, know exactly what's going on, and be able to carry that over in the home setting. So these are just some questions that parents have asked me when they've come in for tours previously, and I was blown away with. I was like, these are fabulous questions. They always apologize to me and tell me that, you know, I'm so sorry for taking up your time, but really these questions show me how dedicated they are to services, and it makes me respect that family so much for really advocating for their neurodiverse loved one. And then after kind of just reflecting, so throughout this process, making sure you're taking notes. And again, I would really encourage you to sample different providers and not just, you know, sign up for the first one. I know a lot of times we're kind of in a crunch where it's like, I just really need help right now though. But I really encourage you, this is a long process. And if we really want to have a great experience, we need to take the time to make sure that the provider and our needs are going to match up. So review and reflect on your notes. Do their philosophies match with yours? Would you feel safe with that provider? Do you feel like they understood your needs? Would this service match your daily schedule, as well as would the provider align with your daily lifestyle? So again, this is just something that I put together because I really do feel like it is very important in this field, being so controversial, being so new, to really empower yourself and know what to look for in an ABA provider, because I can promise you there are some really great ABA providers out there, but there are also some not so great ABA providers out there. And I just want to share that knowledge with you guys tonight. And with that being said, I'm going to go ahead and pass it over to Cindy, who's then going to talk about psychotherapy and some other supports that are available, maybe after ABA or maybe even concurrent with ABA.
Awesome. Thank you, Haley. All right. Hi, everybody. I'm Cindy Spencer. I'm the Clinical Director of Spectrum Social and Recreation Services here in Lakewood, Colorado. As Tiffany mentioned earlier, I'm a licensed clinical counselor, a board certified behavior analyst, and a certified therapeutic recreation specialist. And what all of that means is that I provide counseling and psychotherapy. I also provide behavior therapy, and I'm knowledgeable and educated in ABA as well. And I also provide therapeutic recreation or recreation therapy. And I'll talk a little more about all of those as well coming up so that you guys have a better understanding of what all that means. So the first thing I'm going to talk about right now is learning life skills for lasting success. So this is where psychotherapy, counseling, behavior therapy, all of those supports and services can help continue or carry the torch that ABA services have provided in terms of like early intervention and early childhood. So we carry on with reducing maladaptive behaviors as they arise in new settings and new situations. So as your child or loved one goes through their lifespan, you know, from elementary to middle school, high school, college, and beyond, to working in employment settings and so forth, as well as other social settings, we want to look at how we can continue to help them manage challenging behaviors or maladaptive behaviors in those settings and situations. And we also want to continue to build and maintain those essential skills that are necessary throughout their lifespan. So we're continuing to carry on, generalize, and maintain the skills that they've learned early on in ABA programs. And we also are building on those skills as well. We want to help support the individual in increasing their insight and awareness as to what their thoughts, their feelings, and their behaviors in terms of their experiences are, and develop those skills to manage those thoughts, feelings, and behaviors. We also want to help them, and I'm adding this bit in understanding the normalization of having thoughts and feelings. And in each of our experiences, those are always changing, and how to operate and continue to work through situations while they're experiencing different thoughts and feelings. We want to work on building independence and making life choices, especially as related to their health, safety, and quality of life. These choices are also aligning with who they are and the life that they want to have. We want to support them in increasing connection, communication, and collaboration with others. How do we connect with other people? What are the best ways and the most socially appropriate ways to continue to communicate with people, self-advocate? And also, how do we collaborate with others? Because life is about a series of social interactions, whether we are paying for our groceries at the grocery store or asking about directions, things like that. So we really want to help continue to build those skills and support them in doing that. And also developing self-confidence and a sense of self. So again, about who they are and who they want to be in the world and the life that they want to have. All of that falling under that umbrella of a healthy life, a safe life, and a high quality of life, which is what all of us essentially want and what parents typically want for their children and their loved ones. Okay. So services and supports throughout the lifespan, these are therapeutic services. So starting with counseling and psychotherapy. So in counseling and psychotherapy, we are, again, continuing to support that individual and understanding the relationship between their thoughts, their feelings, and their behaviors. So taking some of those skills and strategies that they've learned in ABA and continuing to expand on those as well, and bringing in the mentalistic or the internal processes that are also happening for that individual. So helping him understand those processes and also working through them. We also would look at family therapy and couples therapy. So when a member of the family is neurodiverse or a member of the couple is neurodiverse, the dynamic is a little different. And so we need to understand those inner relationships, how to communicate, how to connect, what that looks like. So it's a combination of supporting the individual in building skills, but also, working with their significant others or their family members in understanding and adapting in certain ways as well. When looking at behavior therapy and consultation, so I intentionally use behavior therapy and consultation because ABA in and of itself is a very specific. So applied behavior analysis is a very specific evidence-based practice. Continuing on with that, it's a very structured setting. So what do the supports look like when they're generalized and maintained? So I shifted into the verbiage of behavior therapy and consultation. What that looks like for individuals, for families, for significant others is understanding those concepts related to behavior and consulting with them or working with them on how do we continue to reduce maladaptive behavior that may be unsafe or unhealthy or maybe even socially inappropriate, and build skills that are replacement behaviors or more socially appropriate, safer, healthier behaviors. So continuing to provide that consultation and that therapy. Recreation therapy looks like adapting an activity to support the individual and being able to fully participate both socially and with the activity, and also expand and explore recreation and leisure activities. for a lot of individuals that are on the autism spectrum or are diagnosed with ADHD or other type of neurodiversity, a lot of their interests are very rigid or very confined. And so we really want to support that individual on expanding those recreation and leisure activities. And all of that is related to supporting them in a broader social life and a healthier quality of life, to have lots of different experiences that provide them with a sense of joy, a sense of meaning. So recreation therapy is a really amazing program and a service to take a look at. It also involves community integration, building social skills, independent living skills, and so forth. I'm sure many of you are familiar with speech therapy, occupational therapy, and physical therapy, but those are also services that are available through the lifespan, depending on where you live and what type of providers you have available in your area, insurance constraints as well. But speech therapy, as many of you know, involves the communication, language development, social skills as well, and many other services. Occupational therapy often focuses on independent living skills or activities of daily living, as do these other therapies as well. Occupational therapy also can consult and work with the individual and the family on sensory processing and those types of things. Physical therapy more often gross motor functioning, things like that. And I'm not including everything. I'm not as an expert in these, but I hope I'm covering them pretty well on those three. Psychiatry is medication consultation and medication management. So for those whose loved ones are on medication, that psychiatrist will help guide you on what's the best medication to address the concerns that the individual is having or the family is having, whether it's mental health concerns or self-regulation concerns, and various others. And is this the right medication for you? And to support the individual and the family on managing that. Neuropsychology does diagnostic evaluations and assessments. They also do further psychological and skills testing as well, so they can give the individual and the family the formal diagnosis that they need to receive services for insurance. However, they also can do a broader evaluation assessment where we're really looking at specific skills, intelligence testing, and other mental health testing or psychological testing as well, which can give a broader picture. So other services and supports through the lifespan in regards to like skill development and coaching, there's parent and caregiver coaching and consultation. Parents need a lot of support, and a lot of times what we're working on in therapy, we want to support parents in understanding those skills, strategies, and interventions as well, so that they can continue to support the individual outside of therapy. So we really want to continue, again, to generalize and maintain the skills that one is learning in therapy, and having family members, caregivers, or significant others involved can be really helpful, because they're the ones that are with that individual the other 20, some hours a day, and then the other 7 days a week. So we really want to be able to make sure that everyone in their environment, all of those significant supports, are well informed. Executive functioning skills coaching. This is a really great service where we're looking at things like organization and planning, task management, task initiation, time management, self-regulation, and so on. There's many executive functioning skills, and those are largely impacted with the neurodiverse population. So this is a really great service as well. And then there's social skills and social skills groups. So this is where we learn those refined social skills, understanding both verbal and nonverbal social skills, also social thinking. So an awareness of who they are and how they're operating in the world, and what others are thinking and feeling about that, and how they think and feel about others. So a lot of perspective taking, and just really how to navigate that social world. Academic coaching is really coming to the forefront recently, with a lot of individuals having to convert to virtual services or virtual school. And so academic coaching is not necessarily tutoring, but supports in helping that individual navigate virtual school or school in general. So taking some of those executive functioning skills, even social skills, and like, okay, let's lay out the projects and assignments that you have to do. How are we going to prioritize these? How are we going to get this done? Ooh, we need to communicate with your teacher. What do we need to ask? So that type of coaching and support. Also vocational coaching, very similar, but out on the job supports. These are the skills we need to have. This is appropriate behavior on the job. This is like how we communicate with our boss and our coworkers. This is why it's important to be there on time. There's also a lot of adaptive fitness and exercise coaching. So for a lot of individuals, being able to get that energy out, exercise has a lot of benefits, not just physical strength and endurance, but also, being able to self-regulate and have physical activity and choosing things that they enjoy. Psychosocial rehab is, again, a lot of like independent living skills, coaching and supports. And then there's a lot of other skill development and therapeutic programs. There's art therapy, there's equine therapy, there's aquatic therapy. So there's a whole broad range depending on where you live. I know out here in Colorado, we have a lot of like extreme sports camps and outdoor supports and programs. So, there's a lot of options, and it's really amazing how much these are expanding. So how to interview a provider. So outside of ABA, which Haley covered, interviewing a provider, you want to look for a licensed and/or a board certified professional. This means that there is a governing body with best clinical practices and an ethical code. And that's really important. We also want to look at consider the education experience that the individual or the provider has in supporting the neurodiverse population. This is really important because behavioral health, mental health practices for the neurotypical population are one thing, but we need to really have an understanding of what that experience might manifest as in a neurodiverse individual who may or may not even be aware of how to label their feelings or how those behaviors might be impacting them. And so really having a clear insight into what that experience is like for a neurodiverse individual and how to support a neurodiverse individual. A knowledge of best practices in working with the mental and behavioral health needs specific to the population, which we mentioned before. Also, a focus on reducing challenging behaviors and developing skills. So again, continuing that thread that started in that foundation of ABA and continuing to carry that through the lifespan. Parent and family support, which I discussed earlier, including consultation, therapy for the parents, therapy for the family as a whole, coaching, training. All of those things are really important to really bring everybody on board. Having a clear understanding of their expertise and their role and their treatment process. So that provider should share with you, like, these are my areas of expertise. This is the role that I play, whether I'm a coach or a consultant or a therapist, like this is what this looks like. And what is their treatment process? Are they willing to go out in the community? Is it one-on-one in an office? Do they have telehealth available? What is the process? How do they define goals? Do the goals change? How is communication conducted? There's a lot of really key questions there. And then having a warm, supportive connection between your child, yourself, and the therapist. There should be a good rapport. Everything starts with having a really good relationship and building that rapport. That's really important because we are humans and we need to connect, and that connection is the strongest piece of any therapeutic process. So lastly, just speaking about Spectrum Social and Recreation Services. So this is how we collaborate with providers and provide supports through the lifespan. So as Tiffany mentioned earlier, we are a unique group of clinicians with extensive education and experience in supporting the neurodiverse population and their families. We provide supports for individuals diagnosed with autism, ADHD, and other nonverbal learning disorders. We provide counseling and psychotherapy, behavior therapy and consultation, recreation therapy, parent coaching and consultation, executive functioning and social skills coaching and groups, and family therapy and couples therapy. We provide supports with anxiety, depression, trauma, grief and loss, and how these experiences are unique, especially for the neurodiverse population as they are for the neurotypical population. And we operate from a neurodivergent positive model. This is really important. We approach neurodiversity, in autism and ADHD as a neurotype, not a disability. This is how an individual operates in the world, and this is how we are going to support them in that. We also want to collaborate with other providers. This is really big for us, is forming a continuum of care. We are all in this for the greater good and for helping others and helping their families. And so having a great relationship with other providers in the community and other providers that are supporting that individual is so important. Connecting with their pediatrician, connecting with their other therapists, connecting with their teachers. We attend IEP meetings and 504 meetings and all of those things. So we want to really be a part of that and really support everyone that's there for that individual and ultimately supporting that individual. So that is all I have for you guys today. Please feel free to contact Haley or myself if you have any questions about our services or about the field that we work in. We'd be happy to answer those.
Thank you both so much. That was wonderful. And just to, I guess add to what you just mentioned as far as the collaboration, that's a good question to make sure is at the forefront when you are interviewing, when you are talking to the different providers, is to make sure how do you collaborate? Are you willing to collaborate? Because that's what this is about, is that community. Because I know as a parent, it's hard to keep track of the OT, the speech, ABA and all of that combined. So thank you for emphasizing, and I think leaving off on that, because that's where that true work and the results and what we see getting to the next level happening. So thank you guys, or thank you both. I really appreciate that. Please start asking the questions, putting it in there. I've seen a few come through so far. A copy of this this webinar will be sent out. A copy of their presentations will be sent out. So you guys will have those tools. You'll have those resources to have on hand, which is wonderful. One of the questions I know, and that person had to leave, but I'll get back, but I'm sure it's good for the general population, and what services are available virtually that can be provided. As we know, so many people live in various areas and rural areas. So what opportunity do they have for virtual services?
I can start. So for Spectrum, we do offer in-person and virtual services currently in Colorado and Texas. So we recognize that both of those states have a largely rural population. So we do provide both.
So only in Texas and Colorado, can virtually be anywhere?
Currently, the provider needs to have a license in the state that the individual resides.
Okay.
Now, legislation is always reviewing that. And so as of right now, it is a state-by-state basis. So they would like the provider and the individual to be licensed. The provider to be licensed in the state that the individual and the provider reside in. So I have a license in Colorado and Texas, although I reside in Colorado. So any client that I service has to be in those two states that I'm licensed in. I don't have to live there, but they need to live there.
Okay. And Haley, how about you guys? Same?
We focus on clinic-based services, so we feel really passionately about just focusing on one realm. So we don't want to dip our feet into too many different pools. So Behavioral Innovations doesn't necessarily provide virtual services. There have been times in our past, though, during COVID, where we might support virtually, given the insurance company. Really, for that, it comes back to insurance with us. So will insurance provide the funding then for a telehealth visit, because some insurance companies want to see it face-to-face. But talking in general terms for the ABA community, there are options for virtual ABA services. I would say we're looking at maybe 10 hours a week versus in the early intervention side, that's 20 to 40 hours. So that's what I do. But you would be able to do, 10 or less hours a week. So more of a consultation almost, because it would be really hard to provide virtual services when a lot of it's hands-on. So you can imagine, as a parent, you'd be following them around with a tablet, but you'd be the ones having to do all the work, and we would just be instructing you. So not super great on both parties' ends, but we could absolutely do a consultation sort of thing where we talk through some scenarios you've seen, give some tips, maybe have a focused treatment plan where we're just really focused on maybe learning social skills, and that's all we're practicing. There are options out there. Behavioral Innovations, again, the clients that we do have with us, if there's extenuating circumstances, somebody's sick, I have a family, for instance, that's going to Turkey, we'll provide, parent consultations with them virtually, but for the most part, my company doesn't, but there are options out there.
Wonderful. Thank you. I know that's huge. And I did put in the chats the links to both Behavioral Innovations and Spectrum's website, so you guys can check them out too, and be sure to contact them. Somebody did ask, are dyslexics in the neurodiverse category? And yes, they are. The neurodiverse category is anyone with processing cognitive differences, learning differences. So you have ADHD, autism, dyslexia, dysgraphia, dyscalculia, which I always mispronounce, but all of those services are part of the neurodiversity. Did you guys want to add any more to that question?
I think you covered it.
All right. All right. There's a couple more. Is there an age limit for ABA?
No, there's not an age limit for ABA. For my company specifically, we go up to age 10, and a lot of providers will kind of parcel it out, whether it's early intervention, maybe we're looking at like school-based age range, and then kind of into that adult life. I would say a lot of the ABA services, though, will be more of a mixture of like adaptive living skills, community-based things. It wouldn't be necessarily like a clinic where you're coming in. It would be more of that daily living sort of setting, and probably a blend of almost like the psychotherapy components that Cindy works on, that recreational sort of therapy too.
Right. And at Spectrum, we start at age 6 through the lifespan. And it's, we have a wide variety of individuals that we provide services for. I mean, we provide services for, individuals, that are CEOs to, individual, everywhere. So it's a really broad range, and we love that about our practice.
Wonderful. And one of the questions, which I think is an excellent question, if my child isn't officially diagnosed, where do I start? And that's such a great question. And that's one of the things, on our website, we do have a learning differences assessment. So we can help for free parents on their journey to say, where are you at? If you don't have a diagnosis, here's all the resources, here's what to consider, because there's a difference between a medical diagnosis and educational diagnosis. How does that tie in? Because we know that it's important when 504s and IEPs come involved and what that looks like. But I'll let you guys, talk about some of those of where to begin, because an evaluation is what's needed, but I'll turn that over to you guys.
Well, for Spectrum services, for counseling and psychotherapy, parent coaching, family therapy, they do not have to have an official, like formal medical or educational diagnosis. So they could have, and they also can range across the spectrum. So what I was mentioning earlier, neurodivergence is a spectrum, and there are skills and strengths just as there are challenges, and they run all over the place. And so we provide those supports that are very individually based. As many of you have heard, if you've met one person with autism or one person who's neurodivergent, you've only met one. It's very different. And so we are all very, person-centered when it comes to that. And so they do not need an official diagnosis.
For a lot of insurance companies, they do want to see a formal diagnosis to get that process started for ABA services. In the Colorado region and with behavioral innovation specifically, we do have a diagnosing provider list that we could share with you guys today. Again, I know that only covers Colorado, but there are a lot of different diagnosing physicians out there. And again, I would be more than happy to try to help you navigate that situation, because I know that can be very cumbersome, but pretty much we need to find a diagnosing provider. And with that, I know there's a lot of diagnosing providers that have wait lists and different things like that. So there will be, some struggles to look out for on that end. But really starting with finding that diagnosing provider.
Thank you, Haley. If you want to send that to me, I'll go ahead and send that in the materials sending out. And we have some articles online that talk about the different diagnoses, that talk about how to get a proper diagnosis, what that looks like, what to consider. Again, it has some questions on there, just so as you navigate through what that means, because we know there's certain, depending on where you're at, rules, regulations, especially with school, especially getting accommodations of what they need and what they need to have. So we can send all those materials, but that's a great question. Let me see if there's anything else. any other questions that you guys have? I just wanted to, I don't see any other coming in. I know we're getting to the top of the hour. One that I was thinking of as you guys were going through this is, we do the interviews, let's say we're talking to the professionals. At what point do we know, I know some parents go by your gut feeling, but when is time to change services? When we don't feel that it's working, when should a parent kind of pull the plug and say, okay, we need to change providers? What to look for in that respect?
That's a great question. My initial answer to that the first and foremost thing would be whether or not there is a strong connection or rapport between the individual and the provider. That's really important. The other thing to be mindful of is that a lot of skills take time. A lot of processing takes time. And so that rapport building is so essential, but therapists, typically should have a very creative or innovative approach that's very individual based. And so being willing to experiment and try different things, different activities. I know there's been times that I've pulled something really off the cuff, like, hey, let's do this. Let's go for a walk, or let's play this out. Let's do a navigation game around the office. And then suddenly oh my gosh, this wealth of information or this realization happens, and we have this amazing conversation or connection. So just, being aware of that is so important, because a lot of neurodivergent individuals have a hard time developing trusting connections with people, especially outside of the family. And so that takes time, and they want to feel that they're, accepted and embraced and supported. And it takes some time to build that trust. That's super important.
And I would add as well, advocating to be a part of that therapy. Then if you don't feel like it's working, come into the back, see what they're working on, get some hands-on experience with it, try it yourself. And then ultimately, in the applied behavior analysis field, at least, I'm ethically required, to on the part of that ongoing supervision is checking those graphs. Everything we do is data driven. So if I see a graph that's declining, I am required to put an intervention into place. We can't let that just, flop. We really need to change something, and we need to make sure that we're providing effective treatment. But, like Cindy said, sometimes it takes a really long time to acquire skills. But really what we should be doing as providers is really walking you through that and making sure you understand that. So if you don't feel like it's working, hey, come into the back and see what we're putting into place. Really see what we're trying to work out. You're actually the expert in your neurodiverse loved one. I am not. I'm an expert in what I do for a living, but I need you to collaborate with me and really bring you on board into services. But with that being said, there are times where sometimes it's just not working. And I think really what we need to be aware of is lack of communication. That's a huge one. So if your provider is not communicating with you, not showing you, kind of what you're trying to work on. So, we're not all perfect. We're not all going to change those behaviors or increase those behaviors right away. But we need to be showing that we're trying at least, and having an open dialogue and trying to make sure that we're improving the quality of life for parents. And if we're not, ultimately, then we're not doing our jobs. And there are times, where providers aren't a great fit. And I do think communication is a huge one, showing the evidence of what we're working on, as well as just keeping an open line of, I guess it all ties back to really communication. We really need to be communicating. And if we're not communicating and you feel like there's not any progress, I would say absolutely try a different provider. We don't want to waste anybody's time. If somebody really truly felt like I wasn't providing services and helping them, I would look for other providers for them. Okay, I hear you. Ultimately, I want what's best for your neurodiverse loved one. So let me make this a smooth transition process. I hear that you want to, terminate services. That's fine. I will find you a provider that will meet your needs. And I think, sometimes that happens, and we just need to make sure that we're not wasting their time as well.
I think to highlight what Haley just said, which is awesome, was you want to look at really 3 super important things, and that's the connection, the communication, and the collaboration.
Yeah. Yep, I love that. Summed it up. There's one more quick question and then we'll stop. But what is the minimum maximum amount of therapy per week recommended for a well-rounded quality of life for a child? I know that's a very big question, but just as brief as you can, because I'm sure it's individualized. I mean, there should, but anyway, you guys take it from there and then we'll say our farewells.
Yeah, again, it's really individualized. I guess there is a max at 40 hours a week for us at least, because, we're open from Monday through Friday. And a lot of times with the early intervention population, at least, we don't want to work the kids more than 8 hours a day. I mean, 8 hours a day is already exhausting for young kids. So, 40 hours would be maximum for early intervention, but we do all the way down to maybe 1 hour a week of a consultation, not behavioral innovation specifically, but that could also meet the needs of your neurodiverse loved one. So again, very individualized. But for an early intervention child who is showing maybe some challenging behaviors and is showing some deficits in skill acquisition programs, I would recommend on the higher end of 20 to 40 hours a week.
Wonderful. All right. Well, thank you all so much. Cindy, Haley, thank you guys so much for presenting as such good content, having this dialogue, having this conversation, discussing. Thank you all for joining. We will say our good nights and we'll go ahead and send out the information by the end of this week. So good night to everyone. Thank you. It was a wonderful presentation. I appreciate it.
Thank you. Thank you, guys.
Thanks, guys.
Thanks, everyone.